Great, thank you. So again, welcome to the Act Early State team. Oops, I think I might have done that. Okay, so we're going to go over the history of the team and the context so that everybody understands why we're here and what we're doing, which could help us a great deal. Welcome, Lindsay. You can just put yourself on mute. We're glad to have you. So the Act Early State team was supported initially through federal legislation. So I want to introduce this legislation to you. So right now you might be familiar with what's called Autism Cares, the Autism Cares Act. So that stands for Autism Collaboration, Accountability, Research, Education, and Support Act, not to be confused with the current CARES Act, which has to do with the pandemic. The Autism Cares Act was a lovely rewording of what used to be known as the Combating Autism Act of 2006. But in either case, the legislation aimed to support 4 things. The first of these was interagency, or is interagency coordination. So you might have heard of the Interagency Autism Coordinating Council. That's a federal initiative. The other 3 are in bold on this slide because these are initiatives that are supported at the national level, but that we have funding for these. We have instances of these. So the second bullet is surveillance and research. This is a key area of the Autism Cares Act. So in our state, one of the activities that is funded here is the surveillance project in which we are, I'm just muting people as I saw them come in. Maybe Nicole, if you see people come in, you can just click mute for them so we don't have to restate that. So surveillance and research, the ADAM network from the CDC, the Autism and Developmental Disabilities Monitoring Network, is the collection of research projects that are assessing the prevalence of autism across the country. So there are several states that have funding to be doing surveillance on autism prevalence within their state, and we are one of the states that is doing that. The states that have this funding conduct the research in a way that allows us to extrapolate the prevalence for the country as a whole. But in the states where the work is being done locally, we also have state data on autism prevalence as well as trends in relation to disparities by racial ethnic group. So it's fabulous to have that, and we can always share that data with the team whenever you are interested. Another aspect of surveillance is, research. There are research projects that are funded, and we did have a study here that started in 2014 related to implementing developmental monitoring in childcare settings. For professional training and public education, the 3rd bullet, we have the Wisconsin LEND program. LEND stands for Leadership, Education, and Neurodevelopmental and Related Disabilities. This is one of the primary pre-service and professional training programs in the country that includes training on autism, but is much broader than autism. That's a good segue for pointing out that although the federal legislation is called the Autism Cares Act, it really is about autism and other developmental disabilities. And we try very hard to not create a silo for autism. In terms of public education, one of the primary efforts is the Act Early Ambassador Initiative. Every state and territory, or almost every state and territory, has an Act Early Ambassador. And certainly there's funding set aside for every state and territory to have an Act Early Ambassador. So the CDC has a competitive application for this role. We've had an Act Early Ambassador since the project was started in 2011. I was the ambassador before Chris Barnico, who is pictured here and is on the call today, and you'll hear from her. She's our current Act Early ambassador. The photo is from several years ago when the cohort was smaller. It's much larger now. But this is a wonderful cohort of individuals with expertise in early childhood who serve as a bridge between the CDC and other agencies in some instances to make certain that the state or territory has access to materials, resources, and the most current information around developmental monitoring and screening so that they can help their state access that information. And that ambassador works across all sectors. So healthcare, early care and education, and public health. The final aspect of the Autism Cares Act, the final piece that it tries to support, is state systems for early identification, diagnosis, and intervention. So I'm going to go to the next slide to highlight what we have in that area in our state. Oh, I keep clicking the wrong way. Nicole, apologies for that. So we've had a number of funded projects in relation to this area of Autism Cares. So the first part of this is the Act Early State team, which we've had since 2007. I'm going to return to this with a different slide that'll show more detail about the team and talk about it there. And Nicole, I'm having a little difficulty seeing the place to advance the slides when I'm doing this. So maybe I'll just tell you to advance the slide when it's time, and then I won't jumble it as often. So the Act Early State team, every state had one at one point, and some of them are very active, and ours is one of those. Another type of funding that has been available to states that apply is something called the Autism State Demonstration Grant. We had one of these when it was first initiated. Some of you might be familiar with the Connections Initiative. That's what we called our project, funded through this grant. The state demonstration grants are were maybe 2 years long initially. I might have the date wrong, it might have been 3 years, but it's a longer grant, only to a handful of states that are committed to implementing and evaluating innovations in how we offer coordinated care in the state as a whole. So when we first got funding in 2008, each state had a great deal of leeway in terms of what they would implement. One of the things that came out of our funding and our project was the Community of Practice on Autism Spectrum Disorders, which some of you are part of. If you haven't heard about that, we can certainly share information with everybody. It's very active and has been very productive in sharing evidence-based practice and building a community of practice among different professionals and family members in the state to meet the needs of families in our state for autism. Actually, the fourth bullet here is the subsequent funding that was in the same vein as the Autism State Demonstration Grants. They're now called Autism Innovation and Care Integration Grants. And we have had 2 of these. We're on our second one. So the years are there for each grant. And these have focused in more on improving access for medically underserved families and implementing and testing family navigation as an evidence-based strategy. In the course of these grants, we've been partnering with primary care providers and community partners to implement this. So this really marked a shift in the Autism State grants because instead of simply saying, you lead the way and let us know what innovations should be tested, they really pushed for people to focus on 2 things. One, the families who have been left behind as improvements have been made in relation to autism and other developmental disabilities. And 2, they've really pushed us to implement and test the strategies that have an evidence base right now. So that really served to channel the efforts in some way and to create a context in which various states could learn from one another as they tested out those strategies. So the final item here is bullet 3 then, which is the Act Early State Systems Grants. This sounds similar to the Autism State Grant, but this is a smaller pot of money that is for public health innovations on a smaller scale. And we've had 2 of these grants, and in both cases, we were able to work on integrating Learn the Science Act Early materials into public health programs like Family Foundation's home visiting at a statewide level. We also integrated into the prenatal care coordination program and into other programs. So Learn the Science Act Early materials are a support for developmental monitoring, which is a step that accompanies and precedes developmental screening per se and autism screening per se. So actually I did see the arrow that time, so I'll go ahead and advance it myself. So now I want to focus on this bullet that was state systems for early identification, diagnosis, and intervention, but specifically I want to look at the Act Early State Team. So you'll see that on the left here. And I want to tell you that's what we're part of right now. So we're going to put our lens there. In 2007, the Act Early State Teams were first created. It was a pilot program at that point, and it was implemented. If you look at the map on the right, some of you will be very familiar with what this is, and for some of you it'll be new. But this is the regions for the public health system. So Health and Human Services Administration has the country divided by some regions. So we're in Region 5. And Region 5 was the pilot for the Act Early State Teams. Folks from the CDC and HRSA, which stands for the Health Resources and Services Administration, came and in partnership with the Weissman Center, actually as co-leads, and an autism organization in Illinois, we sponsored an event in Illinois where a team from each state came together and went through a process of developing an initial state plan. These were relatively small teams, and there were specific people who were asked to be represented. So parent organizations. There was actually a policymaker or a legislator meant to be in each team, as well as other leaders in the state. So we did draft a plan. The pilot went well, and the federal partners did then cycle through the entire country offering this support for plan development in each region. By the time they were done, they came back to Region 5, and that was 2011. So we then had another regional summit and revised the state plan with a larger cohort, a larger team at that point as well. So at that point, there was not specific funding to support the work of the Act Early State Team. The plan did reflect work we were all already doing in some ways, and it just sort of helped to channel the direction we wanted to go in with that, for that, but we knew that it would also be important to, and supportive to have other funding. So the entire team paid attention to what other funding could we obtain that would help us carry this work forward and help us support actually having live meetings. This time it's distance, but usually we get to come together in person and have lunch as well, which we'll do again someday. But we did then use some of those funding sources that you saw on the previous slide to support the work of the Act Early State Team. So you can see that on the right, the Act Early State Systems Grant in 2014-15, we built in support for the Act Early State Team into that. The Autism Innovations and Care Integration grants that we have had for the past 3.5 years and will have for another 3.5. Also build in support for the Act Early State team. We can cover the meetings as well as some staffing to help just support the logistics. And we're always looking for additional funding to support the work we're doing, whether it's the team meetings or the effort in between, or what happens in between those meetings and evaluation efforts. But this is, although there are funding sources that help us bring the team together, the team is much larger than any one of those grants. It is not driven by those grants per se. It really is a more collective effort. So next slide. I did want to point out that I said the team was fairly small when it began. We were all asked to have fairly small teams because the agencies that were supporting the meetings were paying for folks to come. But over time, we've expanded and we continue to ask ourselves who's missing from the table. By 2017, we had approximately 41 organizations represented in the team. In this current cycle, this is our first meeting, we did go through and clean up that membership list again and really touch base with each person who had been involved to say, are you committed to an active engagement? Does this still fit for you right now? And narrowed down the list actually, so it's a little smaller and more focused, as well as expanding into some more partnerships. So we will, for the first time, have a family physician joining the group with the Wisconsin Association for Family Physicians. I assume that's what it stands for, WAFP. And we have other representation. The team does not represent every agency that matters, but we certainly do our best. And then I think if we go to the next slide, 2 more slides and then we'll finish with this portion. But this is the Act Early State plan. I know that you might not be able to read it on the screen, but I am a visual person, you might be as well. And I think it's helpful to see the 5 goals laid out to some extent here. So I can walk you through what they are. Again, this is the plan that was finalized in 2016 and is our current Act Early State team plan. So the first goal relates to family engagement. It says families who have children with ASD, which is autism, or other developmental disabilities, DD, have access to clear and useful information, accessible community supports, and coordinated systems of care that are family-centered. This family engagement goal also relates to the fact that we want family members to be partners with us at every level of the work. Goals 2, 3, and 4 represent stages in the process of identification and access to services. And you'll see those down the center of the page. So the first is, so goal 2 is systems of early identification and referral. All children receive developmental screening and ongoing developmental monitoring and are referred to services when a concern is identified within a coordinated system of care, including a medical home. Goal 3 relates to assessment, evaluation, and diagnosis. All children receive an evaluation within 3 months after a concern is identified through screening or developmental monitoring. And goal 4 relates to intervention and coordinated community supports. All children who have been identified and or diagnosed with autism or developmental disabilities receive timely and effective individualized interventions within a system of coordinated community-based care. The 5th and final goal relates to statewide coordination. And this basically reflects the fact that we want to be working together to align our efforts so that we aren't rowing the boats in different directions and we can really leverage what each of us and our agencies and organizations can bring to the table so that we're really serving families' needs as best as possible. So my aim isn't to go too deeply into the state plan, but if you haven't been involved in this work before, I think it's helpful to have that information, and we'll certainly share copies of the plan with folks. So next slide, and this should be the final one. And this is a really important point to me, I think for all of us to bear in mind, and that is who's part of the team and what does this represent. So the way I wanted to frame that is by saying that the Act Early State team brings together the Children and Youth with Special Health Care Needs Network partners, as well as other partners who are key to advancing these goals that we've talked about. So I want to mention it this way because I'm going to say CYHCN network because it's shorter. That network is very active, has strong partnerships, and meets frequently to work on these very issues. And that is important work. This team doesn't displace that or replace it in any way. It just brings more people to the table to work on this broad set of goals that are all important to us. So the CYHCN network is comprised of a few partners that receive some funding from the state maternal and child health, children and youth with special health care needs program, which is the Title V program. So you see that in the center on the left. The agencies and organizations that are surrounding it in this circle, most of them are represented on this team. But each of them is a partner that receives some funding from the CYHCN program. And they, as I said, meet regularly. So in case you're not familiar with these, I will highlight a couple of them. The map of Wisconsin represents the 5 regions of the state in which there are 5 regional centers for children and youth with special health care needs. These regional centers are information and referral resources for families and providers, and they're also a valuable point of contact in the region for helping build capacity for medical home or screening or whatnot. So they partner with with community partners in the region to help move initiatives forward. Well Badger is an information and referral resource and a website that is also, it's very complementary in my parent perspective to the regional centers, but does some overlapping things and some different things. So the Family Voices of Wisconsin at the top of this image is the parent-to-parent organization that is the health and I'm going to get the name wrong of this, but the health and information, I'll let Barb correct us at some point, but and if she's on here, she can do that. But anyway, there's a national health type of center that Family Voices of Wisconsin has that project. So apologies that I don't have that on the tip of my tongue. But they are a really important organization for parent leadership and parent voices related to what's needed by folks. The Health Transition Wisconsin and Medical Home logos on here relate to specific initiatives that focus on an important issue for children and their families. The Health Transition Wisconsin effort is housed at the Weissman Center, and the Medical Home Initiative is at the Children's Health Alliance of Wisconsin. Parent to Parent and ABC for Health are not represented on the Act Early State team at the moment. So on the right are some of the agencies and organizations that are represented on the Act Early State team right now. I've clustered them a little bit. So you have parent and organizations that are run by and for parents of individuals with disabilities as well as individuals with disabilities. So you see these here. Now I have not listed Family Voices of Wisconsin in this cluster because this cluster is meant to just add additional partners not represented in the image to the left. The next cluster are some state programs. So the Birth to 3 program is an important partner in this effort. Other child find efforts and early childhood efforts through GPI are really important. CESA, and I apologize, I did not spell that out, but the cooperative education associations, we have CESA 5 represented on the team because of some of the work they're doing in this area. The WIC program, Women, Infants, and Children. Carrie Malone is not always at the meetings, but she is a close affiliate of this effort. And then the next cluster is service providers and their associations. So the AAP, family physicians, healthcare, other healthcare providers. We have therapy providers as well as diagnosticians represented, and community service agencies doing a range of things, including professional development agencies, I should point out. And finally, we have the Weissman Center. You said every state and territory has at least one University Center of Excellence on Developmental Disability. We value partnering with everyone. Oh, thank you. Sharon is pointing out Family Voices of Wisconsin is Wisconsin's Maternal and Child Health Bureau funded Family to Family Information Center. Thank you. That's exactly what I was trying to pull out. So that's a valuable resource. The, as I said, University Center, the acronym is USED, is a valuable partner, and other higher ed and research partners as well. I think we have someone from the Medical College of Wisconsin right now, University of Wisconsin-Milwaukee, for example, but that's certainly not we're not restricted to that. So I am going to end there. If there are any burning questions, you could put them in the chat box. We're at 12:30, so we will momentarily be switching gears to the full team meeting. But please do put any questions in the chat box, and then I can address them either immediately, or I'll weave them in, or someone will weave them in through the meeting.